Class 2 MO Amalgam Restoration. Arrange appropriate armamentarium before triturating amalgam. We use the following amalgam at UTSD, Valiant PhD Extended Set. Tafelmayer matrix system will be used for this exercise. Proper anatomy of the final restoration depends on correct placement of the matrix band. Place a dental wedge, either from the buccal or lingual, to compress the matrix band against the tooth. This will create a tight seal and prevents gingival overhang. The matrix band should be 1 millimeter above the adjacent marginal ridge. The band should be burnished and contoured to impart the desired proximal contours to the restoration. A triturator will be used to mix amalgam. Place the amalgam capsule in the mixing arm. Mix for 10 seconds. Use a mirror handle to break the seal of the amalgam capsule. Transfer the amalgam into a well. Load both sides of the amalgam carrier with amalgam. Insert small increments of amalgam. Start with the interproximal box. Use the small end of the condenser to pack amalgam. Condense towards all the internal line and point angles. Condense apically and laterally with some applied pressure. These lateral and occlusal gingival forces are necessary to condense amalgam properly and prevent any voids at the margins of the proximal box. Continue inserting more amalgam into the preparation. As you get closer to the occlusal, you may change to a larger condenser tip. Less force is needed. With a smaller tip, start condensing amalgam into the occlusal extension. Overpack the amalgam beyond the margins. Rest the tip of the explorer against the matrix and remove excess amalgam from the matrix band. This will define the marginal ridge and the occlusal embrasure of the restoration. Use a carver, anatomical or Cleoid-Discoid, to place the initial central and secondary grooves. Periodically, clean the tooth surface with a microbrush for better visual access. Place a carver, Hollenback or Cleoid, along the cavosurface margin to remove excess amalgam. To avoid submargination of the amalgam, use the tooth anatomy as a guide. As more excess amalgam is removed, refinement of the central and secondary groups will be needed. Cleoid carver can be used to create the mesial pit and the triangular fossa. Once the amalgam is semi-set, the Tafelmeier matrix system can be removed. Evaluate embrasures and margins of the proximal box. A marginal ridge trimmer, explorer tip, or carver can be used to shape the buccal and lingual embrasures by removing excess amalgam. A discoid can be used to round off the mesial marginal ridge. The adjacent marginal ridge can be used as a guide to restore the height of the marginal ridge of the restoration. Continue carving until appropriate anatomy is achieved. Check for marginal adaptation by running the explorer tip from enamel to amalgam and from amalgam to enamel over all the cavosurface margins. Use a burnisher to achieve better marginal adaptation. Use a POH floss to check for the presence of interproximal contact. Use the pull-through technique to remove the floss. Dispose of any excess amalgam appropriately. When handling amalgam, protective eyewear, mask, and gloves must be worn at all times in the preclinical lab.